All right. So we left off last week talking about, I think, with this slide and this part of the subject about degenerative joint disease. Degenerative joint disease has several names. The old traditional name that everybody has heard of is just plain old arthritis. But people get away from the term arthritis or osteoarthritis, same thing, because it's kind of a misnomer. As we know from our medical background, anytime you stick the part of the word at the end called that is itis on the end of something, it refers to an infection of that. And so the typical arthritis that people get and old dogs and old cats and things like that get has nothing to do with an infection. So the term is really incorrect. And that's why people try to get away from that term. So you'll still hear people, including me, that talk about the dog's got osteoarthritis or just plain old arthritis. Probably a better term that you'll hear more commonly is degenerative joint disease, which kind of describes really what it is. It doesn't imply something that it's not. And then the other term that is synonymous also, that's not down on this slide, is osteoarthrosis. So basically that means the same thing. All of them are end stage joint disease that usually happens due to some mitigating factor as the dog got older. So the cartilage erodes away, the joint the fluid dries out, and you have some type of trauma to the joint that leads to undue stresses on that joint, and all of that can lead to your garden variety osteoarthritis, osteoarthrosis, or degenerative joint disease, or DJD, or OA, whatever you want to talk about. It is all about the same. So, having said that, we know it's got a bunch of names. So, what causes it? Basically, like I said, it's a multifactorial, non-septic, meaning non-infectious, non-inflammatory. No bacteria are typically involved. That happens of degenerative or happens of synovial joints over time, and very common, especially as we get older and older and older. Again, most of them are going to be secondary due to maybe some kind of stress, maybe a fracture before. Some of it can be due to developmental orthopedic disease. These animals don't really get this until they get a little bit older in life, but the bottom line could be due to something that didn't form right to begin with. The classic example of that would be dogs with hip dysplasia, which we're going to talk about, or elbow dysplasia, or things like that. So what do we see? Typically, these dogs that come in, it's just, it's like me as an older guy, nowadays. You start to get slower, your joints hurt, in the morning they hurt. It's hard, you get out of bed and it takes a while to warm up and get ready to ambulate all throughout the day. So just intermittent pain, kind of low grade pain. And if it goes on long enough, it becomes more and more painful. Okay, so one of the first things that we see with dogs that develop osteoarthrosis, i.e., osteoarthritis, or DJD of any joint, this is the stifle joint of a dog, but a lot of times one of the first things we're going to see is effusion or fluid accumulation inside the joint. That's a kind of a non-specific finding that we can see with dogs early on, that they will usually get some effusion in the joint. So that's kind of like that's the smoke, if you will, that tells you underneath that somewhere there's a causative agent that's causing the effusion, and start to see degenerative changes of the joints. So this is a lateral view of a dog stifle joint. This is all this fluffy looking stuff in here is fluid inside the joint space. This is fluid, this big bulge of this capsule here is fluid inside the caudal aspect of the stifle joint. Normally in a dog, if you remember, here's the femur, here's the tibia, and there's some anatomic structures you have to remember. So here's the patella. There's a ligament here that you can actually see right here. That is the patellar ligament, and you should be able to see that. And then you have the joint capsule. Well, a normal joint capsule in a normal dog is actually really small. Okay, so it starts and kind of ends about right here on the cranial aspect. Caudally, it goes about right in here. And inside that joint capsule of the stifle joint of a dog is synovial fluid and the cranial cruciate and the caudal cruciate ligaments inside that joint capsule, but it should be really small. And then you have normally anatomically in a dog, you have this large kind of fatty-like structure that lives next to the joint, but outside of the joint capsule and behind the patellar ligament. And this is called the infrapatellar, meaning behind the patellar ligament, infrapatellar fat pad. So it's a big hunk of fat that lives in the stifle joint, and people dogs, cats, probably every animal in the region of the knee or the stifle joints. Okay. So we see that that's the infrapatellar fat pad. So what happens in dogs, if they start to get effusion in the stifle joint, whether it's due to a cruciate tear or whatever, then they start getting a fluid accumulation, more synovial fluid or hemorrhage that starts to form inside the joint space, inside that joint capsule. And over time, if it gets bigger and bigger, it's just like a balloon. It's going to blow up and get bigger and bigger the more you inflate it with this synovial fluid or hemorrhage that's starting to form. And so this cranial portion of the division between the joint space and the fat pad will tend to migrate and, encroach cranially as it gets bigger and bigger. So right now, normally it should be right here, very small. But if you start making more fluid or hemorrhage in here real quickly, it's going to move out this way and it's going to move out that way. It's going to move way out here. So it squishes the fat pad and makes the fat pad really, really small so you don't see it. And that's what's happened here. Normally, we should have just a little bit of joint fluid in here, but now we've got all this joint fluid starting to form effusion, and it cranially pushes the fat pad out of the way. We can only see just a little bit of the fat pad here that's left because we have all this effusion. And same thing caudally. Caudally, it's bulging the capsular surface of that joint capsule way back here. It should be like right here. Okay, so that would be a typical example of effusion as it gets worse and worse and worse. So that's typically, a lot of times we'll see effusion or joint fluid accumulation inside the joint space as an early sign of degenerative joint disease. Okay, here's another example. Here's our infrapatellar fat pad. This is more effusion than we should see. It's kind of going way up in here. Caudally, it's bulging right back in here. But this is the infrapatellar fat pad. Again, it's already small because of this effusion that's starting to form inside the joint. Okay. The next thing that we can start to see is changes of the joint itself. So a lot of times the joint space will become narrowed and much less distinct than normally. And then we start to see changes that are called osteophytes. So I kind of alluded to the osteophytes before in the previous lecture. An osteophyte is defined as a little spicule of bone that forms adjacent to a joint. And again, it's the body's response to this joint is now abnormal. It's unstable. And the body thinks the way to fix that is to let's put bone around the joint. So it starts to deposit all of these little bony spicules on the edges of the joints. Okay. And those are called periarticular, meaning around the joint, osteophytes. So an osteophyte is a little bony spicule around a joint. And it's usually one of the first things that we start to see with degenerative joint disease. Okay, so in the example of this cartoon, here's a coxofemoral joint. So that's the hip joint of a dog. Normally, that's the femoral head of the hip joint. We'll talk more about when we talk about hip dysplasia. But if this joint is unstable, a lot of times we'll start to get osteophytes that form around the femoral head and neck. So you get little bony buildup and around here. And normally, if I go back to the last slide, the femoral neck should be a lot thinner than the femoral head. But once you start putting osteophytes around there, the femoral neck appears like it's as thick or thicker now than the femoral head. And so you get osteophytes that start to form here. Eventually, they'll start to form around the femoral head itself and the acetabular rim because that hip joint is unstable. Body says, well, let's stick bone around the whole thing to try to stabilize the joint. And that bony production are called osteophytes. Okay, here's a shoulder joint. So if I look here, there's multiple osteophytes that I can see. Here's the shoulder joint here. That's the scapula proximal into the humerus. But this large, bony, spiculated looking thing, that's a periarticular osteophyte. It's attached to the infraglenoid tubercle of the scapula, right? And if I look here, this little bony spiculated thing here, again, that's another osteophyte. And that's an abnormality associated with the caudal aspect of the humeral head. That's due to degenerative joint disease or arthritis or osteoarthrosis, however you want to say it. Up here on the greater tubercle up here, we got osteophytes that are forming up in here too. And some of these lines in here are actually osteophytes that just superimposed over that region of the bicipital groove, again, due to chronic degenerative joint disease. The key when you're looking at these to differentiate this versus, because these can become really severe in their appearance and very obvious. And the key to differentiate this versus something that's active or aggressive like cancer or a septic arthritis, which is an infection of the joint, is you look at these and they're all very irregularly shaped, but the edges are still well defined. Okay, that's the key. They can become really big, really irregularly shaped, really funky looking, but if you look at the edges, they still have well-defined edges around them. Okay, so there's osteophytes, a lot of lines. So here's a dog with severe chronic hip dysplasia. Okay, we'll talk about that more, here in a minute about how you define that and better ways to look at it. But this dog here is the coxifemoral joints on both sides. This is the acetabular rim. That's the cup that holds the femoral head. And if you look real closely right in here, you can see this is the acetabular rim, the dorsal aspect of it. And that should cover at least 2/3 of the femoral head. Here, that overlapping area right in there is covering maybe 1/5 of the femoral head or less. Same thing over here. Here's the dorsal aspect of the acetabular rim. It should be coming way back to here, covering greater than half of the femoral head, 2/3 to half. And over here, it's covering just a very small amount. So this dog's hips are going to be unstable because both his femoral heads are not really seated in the acetabular rims as well as they should be. And as a result, again, it's an unstable joint. So the body says, let's put bone around it to try to stabilize it. And when that happens, this is a periarticular osteophyte. That's a little spiculated osteophyte. Same thing over here. You're starting to see them over here. These are osteophytes here on the femoral necks of this dog. So get osteophytes down in here, some osteophytes here. These lines here are also osteophytes. Those are attached at the joint capsule, where the joint capsule attaches there. Osteophytes here. So now I have osteophytes associated with the acetabular rims as well as the femoral heads and necks on both sides. This is a dog with osteoarthritis due to hip dysplasia. Okay. Another example of a stifle joint. Does anybody see any osteophytes around the stifle joint? Yeah, I do. I see. Here's, look at this spiculated pointy thing right in here on the proximal aspect of the patella. Here's another really large osteophyte on the distal aspect of the patella. Here's some osteophytes down in here in the region of the tibial plateau. Here's the fibella or the sesamoids of the gastrocnemius, also are irregular in shape because there's bony production around them, osteophytes. And then up here on the trochlear ridges of the distal femur, there's also osteophytes up in here. So he's got moderate to severe degenerative joint disease around that stifle joint. And he's also got a whole bunch of effusion inside the joint itself and joint space here and a little joint mouse. Okay, so he's got lots of issues going on in this stifle joint, and that's all due to cranial cruciate disease, which we'll talk about more in depth in a minute. But for right now, notice all the osteophytes, and that's due to degenerative joint disease. Again, joint mice, like you would see here, that's a joint mouse. Okay, so that is a little piece of bone that's probably floating, free floating inside the joint space. Whether it's due to a small avulsion fracture, it's due to a piece of an osteophyte that maybe has broken off that's now floating inside the joint space. And sometimes they'll tear a meniscus, and the meniscus cartilage will float around in the joint space. And given time, it will mineralize. So that's a joint mouse inside that joint as well. So that's joint mice we talked about if they're bigger, joint rats, and even joint cats if they get huge. Okay, so again, another really bad knee stifle joint of a dog that's got osteophytes here, here, tibial plateau, so lots of degenerative changes. So what can you do about DJD in dogs, garden variety osteoarthritis? What can you do to help these dogs? And the bottom line is, really, it's pretty limited. You control pain. You can put them on anti-inflammatory drugs, NSAIDs, and things like that. You can give them supplements, chondroitin sulfate, things like that to help their joints. But the bottom line is this is a degenerative process. Over time, no matter what you do, it's going to get worse. There is no cure for it. You're not going to reverse these joints and make them go back to normal. I think the whole goal is to make the dogs as comfortable as possible and slow the disease process down. That's about all you can really do. Okay, so that is garden variety osteoarthritis, DJD, whatever you wanted to call it. Now we're going to move on over. Now we're going to talk about septic arthritis. Okay, so now we can use the term arthritis. In fact, we put the word septic in front of it, which means an infected joint. Okay, big difference. See, these dogs that come in with septic arthritis, a lot of times they're younger and they have an infection in the joint. A lot of times in puppies, it could be due to a penetrating wound. Sometimes it's not due to a penetrating wound. In really young dogs, sometimes if they have an infection of the umbilicus and stuff like that, then it can, that introduces bacteria into the system, and then that bacteria can localize for whatever reason inside a joint and start a really young puppy to have septic arthritis. So what do we see with these? These dogs come in and they're extremely lame. So they're more lame. It's not this chronic, you got to wear out of it kind of lameness. These dogs are three-legged lame, and the joint would, as you would expect, since it's infected, it has the cardinal signs of inflammation. So you feel it, it's got a lot of swelling around it. It's super painful. You feel it, it's hot around the joint, and all that you would expect from an infection. So here's an example, and I see here, this is a distal aspect of the tibia, tibial tarsal regions. So lots of stuff going on in here. There's a screw hole. Okay, so this dog has had previous surgical intervention at some point in the past, but now he's got severe swelling all around this joint space. So probably some intracapsular swelling, probably some extracapsular swelling. But now he's got osteophytes and stuff around the tibia, the diaphyseal portion of the tibia, not just around the joint. Up here around the calcaneus, he's got all this stuff that's starting to form, and even some gas opacities in here. Okay, so this dog probably has septic arthritis to cause all of this degenerative changes, and some of these things are now ill-defined with gas opacity. So he probably has an infection, most likely either from previous injury, or it could be that when they surgically went in, that the screw that they used was infected. Okay, it was contaminated during surgery, or possibly wasn't really sterile, and that leads to an infected septic arthritis. And these dogs, of course, because it is due to a bacteria, most times it's going to be staph or strep, because those are the most common ones. Then a lot of times you can actually stick a needle in here, get some joint fluid, look for bacteria in the joint fluid, culture it, and then put the dog on long-term antibiotics to try to control that infection. So what do we see? Bony lysis, we can see early on, we just see effusion. Here's some osteophytes that we can see around that joint, but we're starting to see little ill-defined osteophytes down in here on either side of the calcaneus and the talus. Lots of effusion centered around the joint, maybe some bony lysis right in here. So it'd be real easy to put a needle in there, get the joint fluid out of it. Again, look at that joint fluid for bacteria and culture the joint fluid. Here's another dog here that's got chronic degenerative changes of this coxofemoral joint. So ill-defined bony lysis right in here around that femoral head, starting to get little osteophytes that are forming here. There's one of those lamellated periosteoreactions. Good chance that this is going to be infected. Can put a needle in there and try to get some joint fluid out to confirm it. Okay, then we're going to talk about hip dysplasia, and probably everybody in here has heard of hip dysplasia and probably even experienced it with one of your own animals, because it is that common. Most of the dogs that get hip dysplasia are going to be large breed dogs. There's certain large breed dogs that, for whatever reason, hardly ever get it. One of those would be Afghans, hardly ever get it. Great Danes hardly ever get hip dysplasia. On the other hand, you have other animals other breeds that get it all the time. Labradors get it all the time. Rottweilers get it all the time. Golden Retrievers get hip dysplasia all the time. So typically these dogs are going to start to show signs of hip dysplasia and discomfort, and they sit funny and things like that. They're a little bit painful anywhere, 3 months to 3 years of age, that this can happen in these animals. We also know that hip dysplasia is an inherited disease. So if the dog's if dog parents had it, the sire and the dam, I guess that's what they're really called, then in those animals, their offspring are going to be much more likely to have hip dysplasia. It doesn't guarantee they will, but their offspring can. And just like anything with genetics, the dog's mother and father could have been just fine, but it could be somewhere back in the grandparent dogs or the great-great-grandparent dogs that gene got passed down. Okay, so we do know it is heritable, and that's the whole purpose that we're going to talk about OFA here coming up. Okay, so it's thought to be heritable. It's a dominant recessive thing, and it can happen also in cats. We think it doesn't. but cats get hip dysplasia quite often. A lot of times they don't show clinical signs of it as much as dogs do, but they can definitely get hip dysplasia. So what happens with hip dysplasia is we have inadequate coverage of the femoral head by the acetabulum. And because of that, it's an unstable joint. And because of that, you get degenerative joint disease and osteoarthritis associated with the hips. Okay. But the underlying feature is you have an unstable joint. So here's a normal VD view of the pelvis of a dog. And you can see here's the coxifemoral joint over here on the right side, dog's right side, here's dog's left side over here. And you can see here's the pelvis, there's the ilium, there's the pubis, there's the ischium, that kind of stuff. These are sacroiliac joints, they look nice. Coxifemoral joints in this normal dog looks really nice too. If you concentrate like on this one over here, what we want to see is nice, deeply formed cups of the acetabular rim. This one's a nice deep, it's not shallow. Really nice, deep formed cup of the acetabular rim. Same thing over here, okay? And then again, if we look at this line right in here that you can see superimposed over the femoral head and the neck, that line actually represents the dorsal aspect of the acetabulum. And in a normal dog, the femoral head, if this, you could complete this just ball looking thing right in here of the femoral head, the dorsal acetabular rim should cover approximately 2/3 and at least 1/2 of the femoral head. So you can see here, there it is. So all of this is being covered by the acetabular rim. So ideally we want 2/3 coverage, but 1/2 will take, okay? Over here, again, here's the dorsal acetabular rim. You can see that line through here. It's covering at least 1/2, maybe up to 2/3 of this femoral head. Now, when you're evaluating dogs for hip dysplasia, the key thing, just like everything back with radiology that we've talked about before, is positioning is critical. The dogs have to be perfectly straight. They can't be crooked, rotated. The films can't be black. They can't be too white. They got to have nice radiographs with really perfect positioning. And in a lot of dogs, that will require general anesthesia to get that, or at least heavy sedation. Okay, so bottom line is we need this to look extremely symmetrical. So this side of the pelvis should look exactly like that side of the pelvis. Okay, so the ilium here, the ilial wing looks just like that one. Okay, these holes right in here, what are these holes in the bone here called? You remember the anatomic name for those in the pelvis? Those are called the obturator foramen. Okay, and again, if the dog is straight, the size and shape of this obturator foramen on the left side of the dog should look just like this one. Okay, if one looks smaller than the other, he's probably obliqued, and then you need to reshoot the film. Okay, the other thing to keep in mind, and I think if I go back here, I can see it just a little bit here, is there's a couple of normal anatomic structures. I'm going to go back and look at this this picture here. Yeah, this one probably do it. On this side, which is relatively normal over here, there is a normal lucent kind of area sitting right in the acetabular rim in here, and adjacent to it, there's a flattened part of the femoral head, okay? There's a ligament that actually hooks in there, and it's got two names. People will call it the ligamentum teres, and some people will call it the ligament of the head of the femur, okay? So that's a ligament that hooks onto the femoral head and the acetabular rim. If you were to go back and you get your bones and you look at your bones, on the acetabular rim, there's a little hole in there. That's the fovea of the head of the acetabular rim. Okay, the fovea in there, and that's where that ligament hooks on. So it's a little indentation or hole inside the acetabulum. There's also a little dimple on the top of the femoral head and a little focal area flattening where that ligament hooks on. So what I'm getting at is this lucent area here is a normal structure. And sometimes if you catch it just right at the right angle, the head of the femur is also lucent and kind of flattened in appearance. And that's normal. That's a normal structure. Okay. If we go back to where we were here, you can kind of see it here. So there's a little flattened area right in here that's normal. And here's that fovea of the acetabular rim where that ligament hooks on. Okay. You can see it here too. So here's the femoral head. This part of it looks very congruent. That's part of the joint. This part of it here is normally going to appear kind of wedged in its appearance due to the combination of the fovea of the acetabular rim and the dimple or flattened area of the proximal aspect of the femoral head. Okay. The other thing to note that I already kind of talked about too is the femoral head in a normal dog should be wider than the femoral neck. The femoral neck should be thinner than the femoral head. Okay. The other thing that you have to look for in some dogs, they will have a very faint white line in normal dogs right in here, and you can barely see it maybe through here. And that is a physeal scar. So that is what's left of the growth plate of the dog. You can still see it. It's closed down. It looks normal, but usually you'll see a white line, and the normal white line in that area is right up in here near the epiphyseal portion of the femur. Some dogs will also get osteophytes that form down in here, and they kind of curve out and they swoop out distally like this. And you don't want to confuse a normal fovea or a normal growth plate scar for osteophytes that form a little further down on the femoral neck. Okay, so here is talking about wedging and the coverage of the acetabular rim of the femoral head. So here's the femoral head. Again, that joint space looks pretty congruent, and we would like that dorsal aspect of the acetabular rim to cover 1/2 to 2/3 of the femoral head. This dog is subluxated. So now this part of the femoral head, the acetabular rim is not covering as much. It's not covering 1/2 to 2/3. It may be covering 1/3 of that femoral head. So that means that's not adequate coverage. That joint is going to be unstable. And what does the body do with unstable joints to try to stabilize them? Let's put bone around it. And those are going to be called osteophytes. Okay, so here again, this is an unstable joint. You can see here's our dorsal acetabular rim. It's not covering anywhere near 1/2 or to 2/3 of the femoral head. Because of that, it's unstable. As the dog walks around, it's kind of pop in and out, pop in and out. And the body says, let's stabilize it, and let's do the only thing the body knows how to do. Let's put bone around it to try to stabilize it. Well, that's going to lead to arthritis. Okay, so the standard view you want to get when you're assessing a dog for hip dysplasia still today is this extended, what they call an extended VD view. So it's a straight position VD view of the pelvis. And this side here should look just like that side. This side of the pelvis should look just like that side, with the femurs extended distally. So caudally here we have extension of the femurs, and the femurs are kind of parallel to each other. They're not frog-legged in appearance, but they're parallel and extended out. And we look for the patellas. The patella on this side should be in the middle of the shaft of the femur here. The patella on this side should be in the middle of the shaft of the femur here. So nice, straightly positioned, extended VD view. Okay. And when you get that, if you look at the coxofemoral joints, this is a normal dog. So here's the dorsal acetabular rim, and we see it's covering 2/3, at least 2/3 to 1/2 of the femoral head on this side. Okay. What about this dog here? Here's the acetabular rim here. How much of the femoral head is it covering on this abnormal dog? And I would say maybe 1/5 of it. So this acetabular rim is extremely shallow compared to this one that's nice and deep. Okay, so this dog is going to get hip dysplasia. Hip dysplasia is a lay term caused by a combination of an unstable joint, usually due to subluxation, which means he's partially out of joint of this coxofemoral joint, which leads to joint instability, which leads to osteoarthritis. So hip dysplasia is a combination of subluxation of the joint and arthritis, osteoarthritis. Okay, here's another normal dog here. Nice coverage here. Femoral head looks great. The neck is thinner than the femoral head. Here's another dog. This dog's still got decent coverage by the acetabular rim, but he's got osteophytes here, osteophytes here, osteophytes here that are starting to form. So he's got some arthritis, minimal subluxation, but he's also got osteoarthritis that's starting to form. Okay, what about this dog? Do you think number one, is he positioned nicely? And the answer to that in my mind is yes. This side of the ilium looks just like that side. This obturator foramen looks just like that one. So he's nice and straight. He's extended. This is that extended VD view. The patellas are in the middle of the femurs. The femurs are somewhat parallel to each other. So he's nice positioning. But does this dog have early signs of hip dysplasia, or would you call him normal? Well, if I was looking at him real close, I'm going to go up here. Here's the acetabular rim. It looks pretty deep, so that's kind of good, right? But if you look real close, this line here going through it, there's the dorsal aspect of the acetabulum over here. And so it's covering this much of the femoral head, which is less than 1/2 and surely less than 2/3. So this side, the left side, is subluxated. Okay. If I come over here, here's the dorsal aspect of the acetabular rim kind of coming up here. And again, it's not covering 1/2 or 2/3 of the femoral head. So this side is also subluxated. So even though he doesn't have any arthritis yet, over time, he's probably going to get arthritis. Okay. Because he doesn't have adequate coverage of the femoral head on either side. But the film is nice in position. So I think we can believe what we see. Okay, so this dog is just an example of a dog that's straightly positioned, one obturator frame, and looks the same as the other side. This side of the pelvis is just like this side. This dog's tilted to the right. This dog's tilted to the left. Now this obturator frame looks big. This one looks really little, and that's because he's crooked. If you shoot a radiograph and he's crooked and one side of the pelvis doesn't look just like the other side, that really means you need to reshoot the radiograph. And again, sometimes dogs will let you do this with them being awake. Some dogs won't. Okay, so we kind of describe normal. We kind of describe what you see when it's not normal with hip dysplasia. Now, how do you evaluate or grade the severity of hip dysplasia in dogs? Well, there's a couple of methods that have been developed over time. The two big ones that are kind of established, one is called PenHip, and you may have heard of that. And the other one is OFA. And so and OFA stands for Orthopedic Foundation of America. And so I'm just going to introduce you to both of them and tell you the good and bad about both ways. Neither way is perfect. Neither way is 100%, just like most things in life. Okay, so PenHip was developed by a PhD guy named Gail Smith. He's a surgeon, was at the University of Pennsylvania, and he developed this method to try to predict whether a dog early on is going to develop hip dysplasia. And you want to predict them early on because we know it's heritable. And so because of that, if we can catch them early on, and if they have signs that they have hip dysplasia, we don't want to breed those dogs. We want to only breed dogs that don't have hip dysplasia because over time, in theory anyway, that should decrease the overall incidence in hip dysplasia in these dogs if we start to not breed the ones that have it. Okay, so this was done first in 1993, so almost a long time ago now. So a long time ago is when it was first described. And so what the theory of this is, we know that an unstable joint is going to lead to osteoarthritis, okay? Because the body's attempt to stabilize that joint, again, is let's put bone around the joint, and that leads to arthritis. And so this Gail Smith guy decided, well, if we can show somehow and demonstrate that even in a young dog, a puppy that may be 6 months of age, if their hip joints are lax, if they tend to distract out, even if you put stress on them, then that means that joint is unstable. And we know over time, an unstable joint is most of the time going to develop arthritis. And so his idea was, let's figure out some way to try to purposely pop the joint out a little bit and see if it's lax. And because if it is, we know he's probably going to get arthritis over time. Okay, so he developed these mechanisms and this little contraption that you put between the dog's femurs when you shoot the x-rays of the hips to try to purposely pop out the joint and see if it distracts. And he would measure, this dog on this side's normal, and even if you try to stress it, that femoral head should not pop out. It should always stay tight in the joint. Okay, this side here popped out a little bit. And so he would measure how much it pops out, how much it subluxate on one side. Okay, and that became known as the distraction index. Okay, so dogs that have a really low distraction index, that don't pop out at all, don't subluxate at all, even when the joint is stressed, that's what we want. And so that's what we want. But the higher the number of the distraction index, then the more likelihood that dog will become dysplastic. And so he did this for every breed of dog for the most part that becomes, that has prone to hip dysplasia. So here's a normal dog here. Obviously, here's an abnormal dog. This acetabularium covers very much. So we know, even though this dog doesn't have arthritis yet, we know that's going to be an unstable joint. It's severely subluxated, and over time, he probably will get arthritis of that joint. Okay, so what did PenHip do is they decided that if you have a distraction index over a certain number, depending on the breed of the dog, that we should go ahead and probably castrate the dog or spay the dog early on so they do not breed, because we know they're probably going to become dysplastic in the future. Okay, that was the whole idea behind PenHip. The only problem with it is that the downside of PenHip is it's up to you as a veterinarian when you try to purposely stress these joints and pop out the coxofemoral joints on how much pressure you actually put on the joint to try to do that. Okay. There's no way, there's no machine to standardize the amount of pressure, how much, force you use to do this. And so it can lead to a lot of errors because not everybody is as strong as everybody else. And some people, if you have one of your best clients that comes in and it's a dog breeder and they're the number one client in your clinic, spend the most money every month in your clinic and stuff like that. The owner wants their dogs to pass. They don't want to have hip dysplasia. They want to sell those puppies for as much money as they can. Some veterinarians might be tempted to not put as much pressure on those hips to try to pop them out as they probably would and normally should. And so it can lead to errors, it can lead to issues and things like that. So again, good idea, I think. But it has it's prone to errors unless you standardize it and do it right, which there's really no way to do that. Okay, the other group is called OFA. This is the more common one, the more established. This has been around since the 60s, so a long time. And with this one, you only need one view, that extended VD view of the pelvis. The downside to OFA is you get this view right. Well, it's the same extended VD view that we showed a minute ago. The downside to OFA is they will not grade the dog and tell you if it passes or not until the dog is 24 months of age. So he's got to be 2 years old before OFA will score the dog. And that's the downside, because with OFA, he's already 2 years of age and he could have already been breeding. And so it kind of takes away the whole thing about it, if we can not breed the dogs that have hip dysplasia, that's going to make things a lot better. Okay, so with OFA, all you do is you would send the OFA radiologist, the radiology group that does this, you send them the extended VD view of the pelvis. It has to be a perfectly positioned film. If it's not a perfectly positioned film, then they will send it back to you. They won't grade it. They'll say you need to repeat the film. Okay, so you got to get a good film to begin with. OFA is its own group, its own radiologist. So me as a radiologist, I cannot grade a dog and for OFA. I can't do that. It has to be done by them. Okay. It's not expensive. You can, I don't even know what the price is now, but it's like $50 or something like that. It's not much to grade the dog for OFA. And it's probably the one that's by far more recognized than PenHip by most of the breeders. Okay. So you send the one view, has to be 24 months of age. You have to send one extended VD view. And in that radiograph, the owner's name, along with the dog's AKC number and birth date and all that kind of stuff, has to be imprinted on the film when they get it. So OFA reads the film and they will grade the dog if he passes or not. So they look at the amount of subluxation, if there's any. They look at osteophytes surrounding the joint, all these different things about the dog to make that decision. So dogs that have passing categories, passing scores, they will grade them even though they pass as excellent, good, or fair. Those are all considered passing scores. You have some that are in the middle that you can't decide. They're kind of half and half. So they borderline, so they don't pass, but they're borderline, and they recommend reshooting the films. And then you have failing scores. So you have mild, moderate, and severe hip dysplasia that are failing scores. And of course, then the recommendation then is you only breed the dogs that pass. Okay. But again, the downside to those dogs, they have to be 24 months of age before they will even score it. And so, a lot of the breeders aren't going to wait for that to start breeding those dogs, which is kind of unfortunate. Okay, so how do you fix a dog? What do you do about a dog that may have hip dysplasia? Well, a couple of things. One is you can do a couple of procedures on these dogs. You can do what's called a triple pelvic osteotomy, which you'll learn about that in surgery. I don't see too many people doing this procedure anymore, so I think it's kind of gone out of vogue. The other options that you have is you can do a total hip replacement, which works really well. So you remove the acetabular, the femoral head and the neck. You kind of remodel the acetabular rim and you put femoral components in there and an acetabular component, which I'll show you a picture of. That works really well. These dogs can do extremely well. They can go back to hunting, fishing, not fishing, hunting, and if they're like a military working dog or stuff like that, they have a really good prognosis. And then the last one is you can do what we talked about before, is this femoral head and neck ostectomy, where you just actually cut out the femoral head and neck. And that's more considered as a salvage procedure. So a lot of these dogs are not going to get back to performing like they did in the past. But if you're just after a dog as a pet and you want to sit on the couch with it and things like that, then it can work pretty well. Okay, so this is a dog that had a triple pelvic osteotomy. We don't need to go into this. You'll learn about it in surgery a little bit, but most of these are, I don't know any general practitioner that does these TPO procedures. So you'll refer them to a boarded surgeon to do it, but again, I don't see this procedure being done much anymore. This dog had a total hip replacement. You can see over here, he's got a hip dysplasia over here too. He's subluxated. He's got osteophytes, so degenerative changes around the femoral head and neck as well. But on this side, they already went and did a total hip replacement. So in this one, they go in and they cut this part of it out. So basically, they do an FHO, and then they put this implant in the acetabular rim, which they secure in there with glue. It's methyl methacrylate glue. And then this is the titanium portion of the femoral head and stem. Okay, and they put that in there, and that's attached in there, sometimes with glue or sometimes without glue. That is just kind of wedged in there, and then the bone marrow kind of invaginates into that area. So these dogs with total hip replacements can do great. Okay, this dog had total hip replacements on both sides. Okay, downside to this is it's really expensive to do, but they do great. Okay, then we're going to talk about cranial cruciate disease. This is probably a good place to take a break before we get on this subject, because this is going to take a little bit longer too. So let's go ahead and take our break. We'll give you 15 minutes. So come back at 11 o'clock your time. Yeah, 11 o'clock your time. Is that cool? All right. See you at 11.